Dr. Trill here with Free to Feed. I am so crazy excited and honored to be able to be talking to you today alongside our newest team member, Miss Hannah. Hannah, thank you so much for being here. And one of the biggest things that I feel food allergy families, especially in their early journey, really struggle to navigate. I know I struggled to navigate was lactation issues versus food allergy issues versus all the other crazy things that happen when you have a baby. There's just a lot. It's a lot and it's so confusing, especially like we're not experts here, right? It would be weird if
Right.
as brand new parents we were like, I know all the things. And so that's where bringing in the experts is so incredibly impactful for these families. So that's why I am so excited for this conversation. Hannah, tell us more about you so everybody else can see why I'm just over the moon. Tell us more about you and your experience and your background.
Yeah, so hi everyone. I am just thrilled to be a part of the Free to Feed team. I just feel that the education and the help that they give is just so incredibly important. And for all the mamas and daddies watching out there, I commend you on your feeding journey, and I know that things can be really challenging at times, and so hopefully I can be here to help you out. So my professional background, I first became a nurse and worked in the family birthing unit. I also worked on medical surgical units, so like pneumonia patients, older patients, and that really gave me a base skill of seeing that all people need compassion and that everybody's story is so different. So then I really was able to, follow my passion and go into family birthing. And I loved ever since I was little. You could find me in the church nursery. You could find me being a nanny. I mean, I was all about the babies. Like mamas had to come and like peel their babies off me because I just loved them so much. And I said that when I grew up, I wanted to be, the baby doctor or a baby nurse. And so here I am. I'm not quite a baby doctor, but I feel like this is the most closest passion that really came to fruition. So then I worked with moms and babies in the hospital and like newly postpartum stuff. Having a baby, that is the most incredible thing that somebody will ever do, and that is just so life changing for families. And on top of that, they most of the time they have breastfeeding struggles and they just don't get the support and the help that they need. So the journey becomes a lot more difficult when it's just you. So I worked as a nurse, and then at the same time I was working for my IBCLC hours because I saw the passion that I had for breastfeeding and for human milk. And then I kind of moved away from the family birthing and I moved into what's called home visiting. So I was a home visitor, a nurse for several years, and I specifically targeted families that were having a really difficult time. Like they could be low income, they could have really crazy social factors, they could just be first time parents and be like, come to the table honestly and say, I have no idea what I'm doing and I need help. And that's very commendable. Um, and so I worked with those families for quite a few years. And then I also worked with medically fragile children. So people with G tubes and, seizure disorders and kind of a wide variety of medical issues in our little community. So that's what made it more challenging was the community is so small that you really have to be the one. If you want to change something, you have to be the one that changes it, for the benefit of these families. And so I went on to become an infant massage instructor, and that was just so crucially important for the families, especially, working families that are coming and they haven't seen their baby all day and they're super stressed out. And they just need their baby's touch, and that baby needs their parents' touch. And so being able to teach that to my families has been so amazing. And I really look forward to incorporating some of those techniques into our online visits.
Oh my goodness, that is incredible. There's so much to dive in there. So thank you for that kind of
Yes.
overview. And thank you for all of the work that you do. I can only imagine the hundreds, thousands of families and littles that you have been so instrumental for. So thank you for your
Thank
work.
you.
Um,
Yes.
and I love what you said specifically about how commendable it is when families reach out for help because that's hard. It's hard to do. It's hard to um, essentially admit that we don't know like what the next step is or we don't know what to do. And in my
Totally.
mind, it would be weird if you did, right? I think it's more strange if, you're completely prepared for everything that could possibly be thrown at you. And so I totally agree that it is very commendable for these families to reach out and say, like, hey, this isn't something I expected. And a lot of times when it's something hard, like lactation issues or food allergy issues, for example, it's also not only is it hard, it's not talked about enough, I feel like, and there's stigma behind it. And then on top of everything else, it there's this, nuance, like expectation that we should know when of course we don't. Of course we don't have
Right.
like all of that expertise. There's people just like you who go to school and get certifications and do a ton of work to know a whole lot about that particular problem. So I
Yes.
really appreciate that. And I love the work of, massage with your baby, especially like you mentioned for those babies who have parents who work. I remember like coming home and just being like, "Give me the baby, give me the baby. I need her on my body." Like it's not biologically normal for me to just be gone for 8 hours or 9 hours
Yes.
after I've had a child. So I would love to deep dive into that just a little bit more
Sure.
when you're talking about baby massage,
Mhm.
so is that mostly for the purpose of connection? Are there other things that kind of helps with?
Yeah, so actually there's a lot of research studies out there that show the benefits of infant massage for like lymphatic drainage, for cardiovascular health, for the bonding is a huge one. That can increase those happy hormones in both mom and baby's brain. And there's just a lot of research pointing to why it's so beneficial, like for NICU babies and for um, babies that are overstimulated could be, some behavioral issues for older children. So it's really there's quite a wide variety of health benefits for people.
I appreciate that. And another thing that I've seen people use baby massages for is they are littles, especially littles with like lactation or food allergy issues who have a lot of gas and a lot of bubbly tummies,
Yes.
being able to help like with relief for that. Is that something that you've experienced with too?
Yes, for sure. I would say every family that I taught, I would always teach the upset tummy. There's like there's a routine, right, that I do, and I'll teach it to them. And I mean, it's amazing. I mean, just the amount of gas relief that the babies can get, and the relaxation that comes with that. And not to mention, I've done it like 1,000 times on my baby.
Yeah.
And I mean, really, it's really, really awesome.
I love that, and I appreciate that, like, with working with someone one-on-one, especially in, like, a virtual setting, you get to essentially, like, kind of be in the home, if you will, virtually, and
Yeah.
get to, like, not only just talk at the parents, but, like, really walk them through, like, "This is what you're doing with your hands, this is the purpose," and, like,
Right.
the hands-on piece I think is so important because then you can see it and say like, "Oh, actually, like, try this method if they didn't like that," or, I see that being
Yes.
so valuable to have, like, that hands-on voice to walk you through how to do it.
Totally. Hands-on teaching is, I think, the best form of education for,
Yes.
especially having a newborn baby or an older baby. You're just already like, why? So just having the opportunity, like, to see that this is, I have a baby doll. Her name's Clementine. And I always tell my families, this is my baby doll, Clementine, and I'm going to show you, XYZ on the baby today. So you
Mhm.
can model this you can
Perfect.
model this, this work that we're doing.
I love it. I love it. And that's something that I absolutely wish that I had tapped into when my littles were younger too. It feels like um there were pieces, right, that like felt right and whatnot alongside our journey, but I didn't reach out for specific help and didn't know about like, oh, there are massages that can help with lymphatic drainage. There are things that can help
Yes.
with these upset tummies when there's a reaction. And knowing those pieces and certainly and I know you work with a lot of like working parents, being a working parent and needing to keep those, like you mentioned, those happy hormones flowing so that my
Yes.
supply stays up. That's so important too. And so
Yes.
I appreciate all of that and like the hands-on, get that oxytocin going.
Yes, that's right.
And so with that, you also have experience on like, the food allergy side too, right? A
Yes.
personal experience. Can you tell us more about that?
Yeah, so gosh, it was about probably 10 years ago that all of a sudden I just bam became allergic to eggs. So any kind of eggs, it doesn't matter if it's cooked raw, like it's still the same reaction. So any kind of cross contamination, if I go over to somebody's house and they left out, a Snickers bar on the counter, and I just so happen to put, like my spoon near that area, I'll have a reaction. And like in the past come years, I've come to terms with like the severity of it and understanding the severity of it. But I think the biggest challenge for us as a family was to have families understand it. Like it's not just I'm not the only one like on this journey. Like my husband's there, my in-laws, my family, because if they have to be 100% proactive, for my safety. And they've really gone above and beyond as they should have, because I mean it's such a big deal. But just getting families to understand like this is a whole family issue. Like it's not just you, Hannah. Like we have to be like everybody has to be on board and understand. And so in the past 10 years I've really been able to come to terms with that. And so that means there's absolutely no eating out. There's absolutely nobody else bringing over dinner to our house. There's no, my husband can't eat eggs. So really it's a whole team effort to keep me safe. And that's so, something that I want to encourage other people to is that, it's not just like you don't have to take the weight of all of it. You don't have to
Mhm.
take the burden of allergies. You can lean on your good people to really help you out.
I 100% agree. And so it sounds like you have like a late onset IgE mediated allergy to eggs. Do you have an EpiPen and all of that?
Yeah, yeah. So I have yeah, and that's the other thing. I mean, that's a whole nother, I have a whole soapbox on that. But just the cost of epinephrine and the cost of emergency drugs is ridiculous. And so we
Egregious.
had to find a doctor who was actually willing to prescribe it in like the raw form. So in like vials, because we couldn't afford, you know, when I first, started having reactions, it was like, how do we manage this? Like we couldn't afford to go to the ER, every night or every time that I had a reaction. So we really had to work really closely with a doctor who like understood where we were and was able to like get me my regimen down, help me understand like this is what I need to take when this happens, and then these drugs with this drug and this drug, and you can probably avoid going to the ER. Because the other thing is that we are so active outside that there is no way that even a helicopter would be able to reach me if I was having a reaction, up in the middle of the mountains. Like Life Flight, I don't know if you guys have it. Yeah, like the air ambulance service. I mean, there would be no way that they could reach me. So we, I really had to sit down and have like a face to face, like you have to be prepared. Like, this is what you have to do. And we've had to do it many times still. But I'd say in the last 4 years, it's gotten much, much, much better.
Yeah. Yeah. And I think one thing that you're hitting on there that's so important too, one, thank you for sharing that with us. I really
Yes.
appreciate it. And two is the fact that there's such a giant learning curve, right? Like you mentioned,
Yes.
like the last 4 years have been better, right? And we're doing a lot better now. But that in the beginning, it was really hard. And,
Yes.
it's just, I hate that word, but it's one food, right? Yet it's so hard to avoid even one food, because of the way our food manufacturing and our restaurant systems and all of that are created
Yes.
and built not for food allergy families. And so
Right.
um, I think that's a place that I would love for to hear your thoughts on. Like, was there anything that you did to give yourself grace through this time, or your family grace through this time? Because often I hear from families like, "Oh, I had a slip and I feel so awful." And there's a lot to unpack there, right? Because it's something that they're
Yeah.
consuming often that's hurting they're hurting their baby, right? And
Yeah.
there's a lot there. Um, but I think it's really important for parents to hear that, like, there is a big learning curve here. Mistakes will happen. You're
Huge learning
normal,
curve.
and it's okay. Does that make sense?
Yes. Yeah. I would say for sure you just have to have the grace for yourself and for other people to know that, like, this is a very challenging situation and it's a very challenging circumstance, and we're going to do the absolute best that we can do. But sometimes that's not going to be, something's going to happen. And just giving yourself grace to really be able to, like, unpack those emotions and those feelings, and be able to say yes, like, it's okay, and it's water under the bridge, let's move on.
I think really big takeaways there are grace, and boundaries, right? Because you also mentioned,
Yes.
we don't eat out, and we had to have really long conversations with my family, if someone else is going to be preparing food for us. And
Yeah.
my husband doesn't eat eggs because if he kisses me, I could go into anaphylactic shock,
Yes.
right?
He
The
would
the
kill me.
the kiss of death. And so
Yes.
grace, yes, but also strong boundaries, I think. And oftentimes that can be hard too, because this may be the first time that you really had to exercise strong boundaries with people who may not be familiar with you doing that with them. And
Yeah.
so it can add like that little extra layer of like, oh, this is a hard thing to navigate.
Yes, it is a hard thing to navigate, and, I would say it's even more challenging when, you have other people, like, spouting things into you, like doubt. Like, even if you just, like, walk by an aisle in a grocery store and you're gonna, like, pick up and you're gonna look at this food and it's manufactured on a facility with eggs, like, I'm gonna put that back, and some stranger will be like, well, why can't you eat that? And it's like, well, I don't really care to go into, like, my whole life story, on this. And, like, people can mind their own business sometimes, I feel like. But
Yep.
that's
Yep.
hard
Those
for people.
boundaries. Yep.
Yes.
Totally get it. Totally understand. And yeah, and a lot of gaslighting, as it relates to this. And one thing that I feel like is hard oftentimes for families too, for parents with infants, is that because their responses are typically non-IgE mediated, they just get like completely blown over, right? It's not a true
Yeah.
allergy.
Oh,
It's not a big
yeah.
deal, right? All of that. And which it couldn't be further from the truth, right? It's still a big
Yeah.
deal. It's still important.
Right.
But our society has the misunderstanding or lack of education around like different types of food allergies and why it's so important. So here's to continuing to push that out. Um,
Yes.
so I'd love to switch gears a little bit on you and talk more about your experience as an IBCLC. One, I know how much flippity flopping work it is to become an
Oh,
IBCLC. So tell us
yes.
about that. I know, but in case our
Yes.
listeners don't, tell us about
Uh,
that, and then tell us about your experience in that field.
yeah. So, becoming an IBCLC has been a long, long process for me. So it took me, I would say probably 4 to 5 years to actually get the certification. And I just received the certification in, it was a couple months ago. So I
Congratulations.
had been working, thank you. I've been working on getting this certification. So when you work towards your IBCLC, you have to have so many hours with breastfeeding families, with support groups, with all kinds of different settings, private practice. Like there's a lot of different requirements, and then there's like, so that's a huge chunk of time. But you're really like you're in the thick of it with families. So I did a lot of my hours on a postpartum floor, so
Mm.
in family birthing, so really helping those people like right off the get-go, helping them learn about breastfeeding. But to be honest, there wasn't enough time in the world like to help them because nurses in the hospital are so rushed. And so, like seeing that experience, it even like drove my passion even more to be like a private practice IBCLC, and like to work for a company like you guys who your values of food allergies align so much with, I'm passionate about that, and I'm super passionate about breastfeeding. And so my work really was done with that, and then I did a lot of work with the home visiting program. So I was a certified breastfeeding specialist through those times. And so really being able to like help families hands on with their pumping needs, with their like, why is their baby fussy, how much milk do you have, how much are you expressing, all the, I mean, there's so many different, there's obviously so many different situations, but being a home visitor really gave me a good idea of a look into how unique your baby is for each thing. Each family is so different, and they have different circumstances, and they might be living with family, or they have 5 other children, and there's just such a wide variety, which is what's so cool about the lactation field, is because there's so many there's so many things that could go wrong, and it could just be like one little adjustment could make all the difference. And I recently had the opportunity to mentor with Melanie at Baby Bonds, to learn some more about tongue tie assessment, evaluation, body work, um, just the importance of a tongue tie, what a role a tongue tie can play in breastfeeding outcomes. And so I really just, she's a phenomenal teacher, and just being able to learn about that, because tongue tie is something they don't really teach you in lactation school. And so being able to have that hands-on experience in real time was so invaluable. And so I'm really passionate about getting those babies back to breast, and like, let's look at, is there function issues, is there oral tie issues, like, is it something with the mom? So just like, it's kind of like an investigation almost, like into like, why is this happening and how can we help this? So that was really like my role of, so yeah, I'd say probably like going back probably 4 or 5 years, I've been working with breastfeeding, pumping, and sometimes formula families, and just try to help everybody where they're at.
I love that. And a quick, huge shout out to Melanie over at Baby Bonds. So if you're not following her, run over there, Baby Bonds Boise. I absolutely appreciate Melanie. Love the work that she does. She's incredible. So
Yes,
love to
amazing.
Melanie. And and I think that's so important, right? It's so important, and I think that that is huge kudos to you that you sought out in your getting your hours, right? The ton of work that you need to do to get your certification. In the midst of that, you also sought out those individuals who would be able to close gaps in your education, right? Close gaps in like, oh
Yes.
yeah, I feel like I didn't get the proper training as it relates to oral function. So like, I'm gonna go find the person who can make sure that I'm closing that gap.
Yes.
And that's just game changing. And second thing, I want to again reiterate huge kudos to you for not only completing and getting your certification, but also like the stamina and the you continued, right? Like
Thank you.
anybody at any point, like a year in, 2 years in, could have just been like, okay, like maybe this isn't on the cards for me. You continue to
Yeah.
persist, and like that persistence is freaking amazing. So
Thank you.
my kudos to you, and for anybody else listening who's like, man, like that's amazing. And I didn't realize that, you know, like if it needs to, it can take however long it needs to take.
Yeah.
And feel supported through that. And that like everyone's journey through finding what they truly love and are passionate about is going to look different. So massive,
Yes.
massive respect for your persistence.
Thank
Um,
you very much.
and then the third thing that I wanted to hit on and ask you more about is really, I appreciate your thought process behind like how it's so important to meet with a specialist, an expert in exactly what it is your problem is, because it's always different, right? It's always different, and like
Yes.
each journey is so very vastly different that there's never a cookie cutter situation where we can just be like,
Never.
this is what you do. And like I wish there was, right? I so wish that there was a cookie cutter situation for all lactation problems where I could just be like, do this and it will fix your problems, or
Yes.
for food allergies, right? Just do this and it'll fix all of your problems. I wish that with all of my heart. But because that isn't the case, that's where things like you going to get your IBCLC because you see the lack of continuity of care for these families, and
Yes.
being able to follow up and having the time and expertise and love and empathy to say, really sit down and say, okay, what are the things that this isn't? What are the things that this is? Can we navigate and tease all of that out? Because often for these families too, it's more than one issue, right? And
Yes. Uh-huh.
so figuring out what it is and each journey being different. I'm sure you could tell us like there's probably never been two families that you've met that were exactly the same.
Right. That's very true.
So, and I know that's the case for me too. Every family that I've worked with, they're all different in a billion different ways. And so that's why it's important to meet with someone one on one. That's
Yes.
why these personal consultations are so incredibly valuable, because you get that personal support to figure out what your journey looks like specifically, not, you know, a cookie cutter, like this is what might be the problem and good luck.
Right.
and
Yes.
and not forcing families to try to navigate it by themselves, right? Because if
Right.
there's a million possibilities, and you know, I've been that parent up in the middle of the night googling, trying to figure out why am I in this crazy, why won't my baby sleep, why does my nipple bleed, you know.
Yes.
Whereas just being able to say to a person, these are my problems, they're already trained in knowing what to ask me, right? These are the
Right.
questions to ask and to dive in and figure out, oh, yeah, it sounds like this. So, with that, I'd also, one, if there's anything else you want to add to that, certainly. And then two, I'd love to ask if you're comfortable about your family. Do you have
Sure.
littles? We haven't talked about them either.
Yes. Yes. So, I let's see. I live in Eastern Oregon, so a super rural part of Oregon. We don't have many, as far as like the professionally side. Um, we might have one IBCLC in the whole area, and she only works in the hospital. So that was another thing. When I had my daughter, it was super hard to get access to lactation care, because like she was having trouble, like she was clicking and choking, and she had torticollis and just like a super tight muscles everywhere. It was like, what is going on? Like, I should know what is happening. And she had a tongue tie, and they're all the providers in the area were like, oh, like, I don't know, I don't know about that. And so I went and I took her down to Baby Bonds, of course, like, because they're the only trained ones. I mean, I'm not trying to dog on anybody else, but truly, Baby Bonds is like, that's
The
your gold
the
standard.
place. Yep.
Yes, the place to go. And so I got her tongue tie done about 8 months of age, and it just made a world of difference. I mean, no pain with nursing, no clicking, choking. She didn't look like a banana anymore. The torticollis,
Yeah.
has been
Yep.
resolved, and just incredible. And so she's about 9 months old right now, and just a little firecracker. We have a family ranch that my husband and I help when I can. So we work together, and we do a lot of stuff outside. So we're big, mountain people. We like to go kayaking, we like to go boating, we like to um, go hiking, and not to mention, I mean, we get a lot of exercise on the farm, but that's for sure. But in our other time, we really enjoy just being outside as a family together.
Mm. I love that. I love that. And I appreciate knowing that, even with your background, with all of your training, that, your tie release was later, right? Your tie release
Yes.
came at, you said, 8 months old, right?
Yes.
Um,
Uh-huh.
and so like that also happens. And it's still important for that release to happen if the person that you're working for with says like, yep, that's what you're dealing with. This will solve a lot of your problems. Um,
Yes.
for you to push forward with that. So just to say that, oftentimes it feels like once our baby gets past like a certain age, the level of dismissal kind of like amps up a little bit, even to
Oh,
say
yes.
like, well, if your baby's made it to 8 months old, like you're fine, right? You've
Right,
obviously
right,
limped along this far.
right.
Whereas I think it's important to push back on that and say like, just because I have doesn't mean I should have to continue, right? Like,
Yes.
and the same thing relates to the food allergy side of things, right? Like, just
Yes.
because my baby may have had, really bad reflux, bloody stool, eczema, whatever it may be, for several months, doesn't mean that we should continue. It doesn't mean that
Right.
we can't fix it now that we know
Yeah.
more and that we can see it and push forward. So, I really appreciate knowing that. And quite frankly, on our side of the journey, I feel pretty confident that likely our daughters are have similar oral restriction issues. And now we're looking at like, do we need to looking at function and deciding, do we need to get
Yeah.
something fixed? And they're
Right.
much older, right? They're 7 and 4.
Yes.
And so just to say that like it's never too late in any
Yes, it's
of
never
these
too
realms.
late.
Yeah, it's never too late. Um, and to say that like you're not alone. Even those of us who have experience, it may take longer for us to like get the right support around us
Right. Yes.
to push to the next step. So
Isn't
I
that true?
really, right, I really really appreciate you hitting on that in particular. So with that, with Free to Feed, you are coming on to help families as an IBCLC with a background and training on the food allergy front as well. So I would love to hear if families are listening right now and they're like, I do feel like we have some lactation issues. I would love to be able to talk to an IBCLC. Who are the families that would benefit from meeting with you?
Oh, man. I mean, I would give you my answer, but because I think
Everybody.
everybody,
Yep.
everybody, I mean, I may be biased, but I really think that lactation, an IBCLC visit with an IBCLC is so life changing that just, I mean, I think that if you're having any struggles whatsoever, no matter like if you quantify them as large or small, like get in to see an IBCLC, because there could just be like one little like positioning fix that could change, your latch, or there could be just like you could have um I mean, there's just, I mean, that's such a vast array that sometimes people are like, oh yeah, this is normal. And when we get to talking, it's like, oh no, no, like there's definitely, like, we could change some things here that is going to improve both mom and baby by a lot. So I would say I would encourage all families to access an IBCLC.
Yes, I agree 100%. And I fell into that kind of trap, if you will, early with my first daughter, in that like I didn't know what wasn't normal, right? And so I was
Right.
like, maybe, I mean, maybe your nipples just bleed for the first few weeks and then,
Oh, ouch.
and no, the answer is that's no, absolutely not. They shouldn't.
Oh, no.
But like I really struggled in the beginning, and I had this concept that like it was my fault, and that's a lot for me to unpack another
Yeah.
time. But that this feeling that like, well, it was my fault. This should be normal. This should be natural. Maybe I just, I just need to give it more time. But everything from like that to, like you said, even simple issues. Oftentimes we don't know if there's something wrong,
Yes.
and that
Yeah.
and that it could be better, right? We've never experienced
Right.
this before, so we didn't know that it could be better. And even if it's, our second kid, our third kid, our fourth kid, we may have had issues with our previous lactation journeys and not know, even several children in, this could be better, right? This could be better.
Right.
This could be easier. You deserve that. Your baby
Yes,
deserves that.
totally.
And you're worthy of all of that and all that love and support. So I love that answer.
Yes.
Everybody needs to see an IBCLC.
Woo!
Um, totally agree. So I totally agree. All families, everybody who is lactating, if you haven't seen an IBCLC yet, or if you've seen one and you're still having issues, or any version, you deserve help. You deserve and are
Yes.
worthy of that support and love. And someone who truly wants to help you reach your goals, whatever those may be, and understands that like those goals will change over time too. And that's normal,
Yeah.
natural, and okay. And one of the like pitfalls that I see us sometimes falling into, I know, I did, and I hear this from families a lot, is like, well, it's not as bad as, and then insert
Hmm.
like their friend or their family. In my experience, this sounds often like, yeah, my baby is bleeding, in our GI tract, but it's not as bad as the diaper that you share, right? So I have a picture of like my daughter's egregiously bloody stool,
Oh,
and I'm
yeah.
and just say like, your journey is still just as valid as mine is. And here's to like not
Yes.
getting to that point of your baby having, my daughter's stool. That's not what we want. And you still are just as worthy as help and support and love as I was in my journey. So, um,
Yes.
I think that happens on the lactation side frequently, of like, well, it's not as bad as Susie down the road or whatever it
For
may be.
sure. Yeah.
So,
But people don't know only you know your story. And only you
yes,
can be the one that can reach out for help. So yeah,
and
I
advocate.
just think it's, yes, so
Yep.
important.
Totally agree. Totally agree. So, with that, is there anything that we didn't cover, Hannah, that you want to talk about, before we kind of wrap up?
I don't think so. I mean, I'm just super excited to serve Free to Feed, and I'm excited to help mamas and babies, and help with your breastfeeding goals and dreams, and really help it to be, what you want it to be. So I am here, and I'm just so excited.
Yay. Yes, yes, yes. So, with that, you can find Hannah over on our website, freetofeed.com/consults. Again, Hannah, thank you so much for taking the time to chat with me today, share your
Thank
own
you.
journey. I know that sometimes that can be hard to like deep dive into, the past and our food allergy journeys and all of that. So, thank you for sharing that.
Yes.
And I also want to hit on the fact that you shared specifically about what a lot of these parents like biggest fears is that their child might have an IgE mediated allergy in the future.
Yeah.
And what was so valuable to me in your discussion of your journey was you talking about how it gets better, right? It's been hard,
Yes.
it's a lot of work, and it gets better. And
It does.
so
It gets better.
it gets better. So wherever you are in your journey today, for our listeners, you're doing an amazing job. I'm so incredibly proud of you. My bra's off to you, and we will see you next time.